Good evening, this is Dr. Thomas Klein coming to you from Raleigh, North Carolina. Today we're going to be talking about a different issue about diabetes. Why are we talking about diabetes? We're talking about diabetes because I'm a generalist and I see patients with diabetes. I see patients with all kinds of things, at least I used to see patients. When I presented my research about opiates and the fact that opiate addiction is rare or uncommon, and I posted it on the internet, a complaint arose from a woman in New York who I had never met before that I was putting out dangerous or seditious material. The North Carolina Board of Medicine agreed, did an investigation, called in the DEA, and they took my career away from me. So I'm no longer able to see patients, but I am able to continue doing research. I've had a very large interest in the research on diabetes for quite some time, and I've collected 2,500 papers over a period of 3 years. I had lots of patients in my now defunct 45-year career, and I stay in touch with a lot of patients, so I kind of know what's going on. The research on opiate pain medicine, the stuff they call opioids. Opioids are really opiate pain medicines. Really kind of came to the conclusion that the problem is not the opioids. It's not the opiate pain medicine. The problem is the failure to treat people who have opiate addiction disease. So when I did this research, I've come to the conclusion that the blood sugar is not the problem. Now that goes counter to a lot of people who believe that the blood sugar is toxic, and when it rises to certain high levels, it starts to destroy your body, and it starts to cause all these terrible complications that you read about, especially at the American Diabetes Association website, going blind, losing your legs, and ending up on dialysis. Those are pretty scary things. The question is, does the glucose actually cause that? And what my research has shown is that it doesn't cause the complications. Diabetes is actually diabetes type 2, we're talking about type 2 now, is an inherited disease of weak capillaries that leak, and the leaky capillaries cause problems. Type 1 diabetes is a totally different disease. Type 1, type 2, totally different diseases. They have the same name, and that's all. Now, they've done research on type 1 diabetes, the famous study out of Boston that's quoted for years and years. But you can't take data from a type 1 diabetes group and apply it to type 2 because they're different diseases. You can't apply research done in cat disease to dog disease. Those are different diseases. So there's going to be some sessions that we're going to do on the various aspects of the treatment of diabetes, what causes it, when it was discovered, and give you a complete overview. And kind of like with opiate pain medicine, people should be able to make their own choices. There's a lot of pressure and fear being applied to diabetes, much the same as pressure and fear was applied to opiate pain medicine or opioids. The glucose is not the enemy. Opiate pain medicine is not the enemy. So we're going to switch over and start talking about diabetes. You can subscribe to my channel. You can press the little bell, and that will notify you of new ones.